Dr. Blase, before President Obama expanded Medicaid to include able-bodied working adults, traditional Medicaid covered the poor, pregnant women, people with disabilities. Is that correct?
That's correct, Senator.
And today those people are still covered, are they not?
Correct.
And is it not the case that for those folks in traditional Medicaid, for every $1 that, this is an average, for every $1 that a state puts up, the federal government puts up $1.33. Does that sound about right?
That's average across the country, Senator.
All right, now President Obama, through Obamacare, extended Medicaid to able-bodied working adults. Is that correct?
Correct.
And on average, the federal government for those, I'll call them Obamacare, Medicaid, expansion enrollees, for every $1 that the state puts up, the federal government puts up $9. Is that correct?
That's correct.
Okay. So if you're a governor for traditional Medicaid, you can get $1.33. For Obamacare expansion enrollees, you can get $9.
That's the math that they face.
Right. Now, if you're a governor, you're going to try to get as many people on Medicaid through Obamacare expansion, are you not?
That is the incentive that states have, Senator, yes.
Do some governors cheat?
There are definitely some states that have a massive problem of improper enrollment. So people who would be—
Do some states cheat?
Yes.
Okay.
Many states cheat.
Now, the states determine, in accordance with federal rules, who's eligible for Medicare. Is that for Medicaid? Is that the case?
Yes.
Okay. Now they have to do it in compliance with federal rules, right?
There's the federal eligibility rules that the federal government does a very poor job of enforcing.
Do all states follow the federal rules?
No, they don't.
Some of them cheat, don't they?
Many of them cheat.
Right. Do some states just accept people's word that they make a certain amount of money and therefore qualify for Medicaid?
Yes, Senator.
Do all states say, listen, we hear you and we're not saying you're lying, but we're going to cross-check your application with our state income tax records? Do all states do that?
Not all states do that.
Okay. If they did, they would find out that some people are lying, wouldn't they?
They would.
Now, what's your best guess as to how much per year this cheating costs the federal taxpayer?
We released a report on this yesterday, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Okay. And that's $33 billion that is taken away from the people who really need Medicaid. Is that right?
Yes.
Okay. Has anybody gone to jail for doing this?
Not to my knowledge.
Don't you think we ought to start putting people in jail for cheating?
I think that it's financial fraud against the federal government, yes.
Sir, on the end, I'm sorry, I can't read your name. Sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I
cheating?
do not believe that.
Right. If they were cheating, what planet did you just parachute in from? Sir?
Sir,
You don't
I've worked
believe
on
states
this.
are
I've
cheating?
worked on this program for a long time.
But I'm be
It's
sure to
not
understand,
perfect,
you don't
but
believe
states do not
you don't
cheat.
believe states are cheating.
I do not believe states are
Do you
cheating.
believe in the tooth fairy? Sir? Do you believe in the Easter Bunny? Do you believe that Jimmy Hoffa died of natural causes? You're not answering.
I do not believe states are cheating in their administration of the Medicaid program.
Okay. I'm glad you have some water in front of you because your pants are on fire. Let me go back to Dr. Blase. Tell me in the 13 seconds I have left, other than putting these people in jail, both the people who cheat and the bureaucrats who allow them to cheat, how else you would fix Medicaid?
So the key problem with Medicaid is that the more states spend, the more money they get from the federal government. So to set the certain amount that states get, and all state spending on top of that comes from the state, that would be an ideal reform. But I'd say a first order reform is to end the discrimination against the most vulnerable. There shouldn't be the federal government incentivizing states with 7 times more money for the able-bodied than traditional enrollees.
Sir, to the gentleman in the end, I don't mean to be rude to you, but if you really believe there's no cheating, you need to put down the bong. That's one of the most extraordinary statements I've ever heard a witness make.